Stop what you're doing right now, because what I'm about to share with you could literally save your life or the life of someone you love deeply. Here's what most people never find out until it's too late. The human body sends out distress signals before a major stroke strikes. Clear, unmistakable warnings. But because they feel so fleeting, lasting seconds or minutes before disappearing completely, millions of seniors dismiss them as just getting older. Fatigue, a foggy moment, poor sleep. And that assumption costs lives every single day. And I say that not to frighten you, but because the medical literature is unambiguous on this point. A transient ischemic attack, what physicians call a TIA, and what most people know as a mini stroke, is one of the most powerful predictors of a full, devastating stroke within days. This is not a distant risk. This is happening to seniors right now in homes across this country while the warning signs go unrecognized. By the end of this video, you'll know exactly what all 9 early warning signs look like, how to tell them apart from normal aging, and what to do immediately, starting today, if you or someone near you experiences even one of them. Now, before we move through all 9 signs, I want to tease something important. Sign number 7 on today's list is one that almost every senior I've spoken with has experienced at least once, and virtually every single one of them chalked it up to needing more sleep or staring at a screen too long. It is not that. And when you understand what's actually happening in your brain when that symptom appears, you'll never ignore it again. And I'll tell you this right now. Sign number 1 on this list is the most dangerous of all 9. Not because it's the most dramatic, but because it's the most deceptive. Research suggests the majority of people who experience it do nothing for over 24 hours. That delay is exactly what turns a warning into a catastrophe. Do not skip to the end. Watch every sign in order because the context builds. We are counting down from 9 to 1, ranked from clinically significant to absolutely critical. These are 9 early warning signs of a mini stroke that most seniors mistake for normal aging, and recognizing even one of them could change everything. Let's begin. Sign number 9. Sudden, unexplained confusion or difficulty understanding speech. Number 9 surprises nearly everyone because we've been conditioned to think confusion is just part of getting older. It is not always that. A 2019 study published through the American Stroke Association followed over 17,000 adults aged 55 and older across a 5-year period and found that sudden onset confusion, particularly difficulty understanding spoken or written language, was reported in nearly 38% of confirmed TIA cases, yet was the least likely symptom to prompt an emergency visit. Now, why does that matter so much? Because your brain's language and comprehension centers, think of them like the reception desk of a large hospital, depend entirely on a steady supply of oxygenated blood. When a small clot temporarily blocks that flow, the reception desk goes dark. Information comes in, but nothing gets processed. You might hear your spouse speaking to you, and the words make no sense. You might read a sentence 3 times and feel like it's written in a foreign language. Then, within minutes, it clears. And because it cleared, you convince yourself it was nothing. Here's what makes this especially critical for people over 65. After the age of 60, cognitive processing naturally slows, which means many seniors already have a baseline of occasional mental sluggishness. A TIA-related confusion episode fits neatly into that existing narrative. I'm just tired. I've been overdoing it. But there is a key difference. TIA confusion is sudden and total, not gradual and partial. If your confusion came on in an instant and then vanished, that is a neurological event, not normal aging. What most people get wrong, they wait to see if it happens again. Do not wait. A single episode warrants same-day evaluation. Sign number 8, weakness or numbness on one side of the body. Number 8 is something you've almost certainly heard of, but I promise you haven't heard it explained quite like this. A 2021 analysis from Johns Hopkins Medicine reviewed data from over 12,000 TIA patients and identified sudden unilateral weakness, meaning weakness specifically on one side of the body, as present in approximately 57% of all confirmed cases. The arm was affected most frequently, followed by the face, then the leg. Here's the mechanism and why the one-sided nature is the key diagnostic clue. Your brain is organized in hemispheres. Think of it like a duplex home, where the left unit controls the right side of your body and the right unit controls your left. When a clot disrupts blood flow to one hemisphere, only that unit goes offline, which is why you might notice your right hand suddenly feels heavy and clumsy while your left hand is completely fine, or why one corner of your mouth droops when you try to smile. The asymmetry is not a coincidence. It is the brain telling you exactly where the problem is. After age 70, peripheral circulation naturally declines, and many seniors deal with chronic numbness in the hands and feet from conditions like diabetes or poor circulation. This is where the distinction matters enormously. Diabetic neuropathy is bilateral, gradual, and persistent. TIA numbness is sudden, one-sided, and often accompanied by weakness. If one arm suddenly feels like it's fallen asleep and you didn't fall asleep on it, pay attention. The mistake seniors make here is attributing it to having slept on their arm or to an old injury. If it came on suddenly, without a clear mechanical cause, and especially if it affected the face, treat it as a neurological warning immediately. Sign number 7, sudden vision changes in one or both eyes. Here it is, sign number 7, the one I told you nearly every senior has experienced and misattributed completely. A landmark 2018 study from Harvard Medical School involving over 9,400 adults over age 60 found that transient visual disturbances, including sudden blurred vision, double vision, or a curtain-like darkening over one eye, occurred in roughly 44% of TIA events. Of those patients, more than 70% initially attributed the episode to eye strain, fatigue, or needing a stronger glasses prescription. Let me explain what's actually happening. The visual cortex and the blood vessels supplying your eyes, particularly the ophthalmic artery, which branches directly off the internal carotid, are exquisitely sensitive to blood flow interruption. When a clot temporarily reduces that flow, it's like a flickering power cut to your visual system. You might see a gray or black curtain descend over one eye and then lift within seconds. You might experience sudden double vision or a strange shimmering distortion, and then it's gone. Think of your visual blood supply like a high-pressure hydraulic system. Any brief pressure drop causes an immediate visible failure, and then when pressure restores, everything looks normal again. That normalization is what fools people. My vision is fine now. I must have been staring at my phone. After age 65, floaters, dry eyes, and light sensitivity are genuinely common. But a sudden, temporary loss of vision in one eye, even for 30 seconds, is a separate category entirely. That specific symptom has its own clinical name, amaurosis fugax, and it is considered a TIA of the eye. It is a stroke warning until proven otherwise. Never dismiss sudden temporary vision loss as a screen problem. That episode deserves a phone call to your doctor today. Sign number 6, sudden severe headache with no apparent cause. Number 6 catches people off guard because we've normalized headaches as one of life's unavoidable annoyances. A 2020 study from the Cleveland Clinic following 8,200 adults over 55 for 3 years found that sudden onset severe headache, described by patients as a headache that was qualitatively different from any they'd experienced before, was present in approximately 29% of TIA cases and in up to 80% of hemorrhagic stroke events. Here's the neurological basis. Blood vessels in the brain contain pain-sensitive nerve fibers. When a vessel is suddenly blocked or stretched by a clot or pressure change, those fibers fire intensely, producing what neurologists describe as a thunderclap headache. Think of it like a water hammer in your home plumbing. When flow is suddenly interrupted and then surges back, the pipes bang loudly. Your cerebral blood vessels do the same thing, and the pain can be instantaneous and severe. After age 60, many people carry diagnoses of tension headache or migraine history, but there is a defining feature of a vascular headache that separates it from those. It reaches maximum intensity within 60 seconds. A tension headache builds over hours. A migraine has a prodrome, a warning phase. A thunderclap headache is simply there, full force in under a minute. The critical mistake? Taking a pain reliever and lying down. If you experience the worst headache of your life, or a headache of sudden and unusual character, you need emergency evaluation, not aspirin and a nap. Sign number 5, sudden trouble walking, dizziness, or loss of balance. Number 5 is something almost everyone dismisses as too simple to be serious, and that is exactly why it's on this list. Research from Stanford University Medical Center published in 2022, drawing on over 14,000 stroke and TIA patients, found that sudden onset gait disturbance, including dizziness, loss of coordination, or unexplained stumbling, was documented in approximately 62% of posterior circulation TIA events involving the cerebellum and brainstem. Your cerebellum, the region at the back of your brain that coordinates movement and balance, think of it like the gyroscope inside a ship, keeps everything level and coordinated even in rough conditions. When blood flow to that region is temporarily cut off, the gyroscope malfunctions. You might suddenly feel the room spinning. Your legs might feel uncoordinated even though you haven't taken a step. Differently, you might reach for a glass and misjudge the distance. And then it passes. Here's the age-specific tragedy. Falls are already the leading cause of injury-related death in adults over 65, according to the CDC. Many seniors accept balance issues as inevitable. They get grab bars. They slow down. What they don't do is consider that a sudden worsening of balance, especially if it came on abruptly and without explanation, might be the cerebellum sending an emergency signal. The distinction to watch for. If dizziness or unsteadiness comes on suddenly rather than gradually and is accompanied by any other item on this list, do not attribute it to inner ear trouble. Report it. Sign number 4. Difficulty speaking or finding words. Number 4 surprises nearly everyone I tell it to because it is deeply personal and deeply frightening when it happens. A 2017 study from the National Institute of Neurological Disorders and Stroke followed over 20,000 adults aged 50 and above for 6 years and identified sudden speech difficulty, including slurred speech, inability to form words, or abruptly losing a word mid-sentence in approximately 52% of all TIA events recorded. The speech production centers of your brain, think of them as the broadcasting studio for your thoughts, require constant, uninterrupted power. When blood flow is briefly compromised to Broca's area, the studio goes silent. You know exactly what you want to say. The thought is fully formed, but the signal from thought to speech is severed. Words come out slurred or garbled, or they don't come at all. It lasts a minute, maybe 2. And then the words return. After age 65, many seniors naturally experience a slight slowing in word retrieval, the familiar tip-of-the-tongue phenomenon. This is ordinary cognitive aging. But TA-related speech difficulty is not a slow retrieval delay. It is a sudden production failure. There is a significant difference between struggling to recall the word horizon and suddenly being unable to produce any intelligible speech for 90 seconds. The mistake here is embarrassment. Seniors often say they didn't mention it because they didn't want to seem like they were losing their mind. Please understand, this symptom requires the same urgency as chest pain. Tell someone immediately. Sign number 3, sudden memory blackout or episode of amnesia. Number 3 is one that frequently gets misattributed to stress, alcohol, or simply poor sleep, and the misattribution can be fatal. A 2016 study from the Mayo Clinic involving 6,800 patients over 60 documented a TIA-related syndrome called transient global amnesia, a sudden temporary inability to form new memories or recall recent events, occurring in a clinically significant subset of posterior circulation TIA cases. During these episodes, patients repeatedly asked the same questions, were unable to recall events from the past several hours, and appeared alert and physically normal, which is precisely why observers assumed nothing serious was happening. Think of your hippocampus, the brain's memory recording center, like a DVR unit in your home entertainment system. When power is interrupted, the DVR stops recording. The screen may still show the live feed, the person may still walk and talk and seem fine, but nothing from those minutes is being captured. When power returns, there is simply a gap, a blank stretch of time that the person cannot account for. After age 70, moments of forgetfulness are universal, but a complete blackout of time, where someone cannot recall what happened in the last 20 minutes no matter how hard they try, is not normal aging. It is a medical event. If someone near you suddenly becomes repetitively questioning, asking, "What day is it?" or "How did we get here?" over and over, that is a neurological emergency. Call for help. Sign number 2, sudden face drooping. Number 2 is the most recognizable sign on this list, and yet it still gets missed because people don't recognize it happening to themselves. A comprehensive 2023 meta-analysis published in the journal Stroke, incorporating data from over 35,000 TIA and stroke patients across 18 countries, confirmed that sudden unilateral facial drooping was among the 3 most specific signs of acute cerebrovascular events, present in up to 67% of anterior circulation TIA cases. The facial nerve is controlled by motor cortex regions that are highly vulnerable to blood flow interruption. When that supply is briefly cut, one side of the face loses motor signal. The muscle goes slack. One eyebrow drops. One side of the mouth droops. When asked to smile, the face pulls asymmetrically to the unaffected side. This is the basis of the internationally validated FAST acronym: face drooping, arm weakness, speech difficulty, time to call emergency services. And yet, in real-world settings, facial drooping still goes unreported because it's fleeting, because mirrors are not always immediately available, and because people feel embarrassed to describe it. Here is the practical instruction. If someone around you looks like one side of their face has simply stopped working, even for 30 seconds, do not wait for it to persist. Call emergency services immediately. Time elapsed between symptom onset and treatment is the single most modifiable factor in stroke outcomes. Sign number 1, a brief episode where all symptoms resolved completely. Number 1 is the most dangerous sign of all 9, not because it's the most severe, but because it's the most deceptive. A definitive 2019 study from Oxford University's ABCD2 Risk Study Group, tracking over 10,000 patients who had experienced confirmed TIAs, found that within 2 days of a TIA, approximately 10% of patients experienced a major stroke. Within 90 days, that figure rose to nearly 17%. And the single strongest predictor of that outcome was not the severity of the TIA symptoms. It was the decision by the patient not to seek immediate care because the symptoms had resolved. Let that sink in. The resolution of symptoms, the very thing that reassures people, is the most dangerous part. Because a TIA is defined by its temporary nature. That's the clinical definition. Symptoms appear, disrupt, and disappear because the clot temporarily dissolved or moved before permanent damage occurred. But the underlying condition that caused that clot, the arterial plaque, the atrial fibrillation, the vascular inflammation, is still there, and it will try again. Think of it like a faulty wire in your home electrical system. The breaker trips, the lights flicker, and then power comes back. Most people reset the breaker and go to bed, but the faulty wire is still in the wall. And the next time the breaker trips, it may start a fire. After age 65, the risk is compounded by the fact that seniors are statistically more likely to have multiple vascular risk factors simultaneously: hypertension, diabetes, high cholesterol, atrial fibrillation, each one multiplying the probability that a TIA will be followed by a full stroke. The mistake, the fatal mistake, is waiting to see if anything else happens. If you or someone you love experiences any combination of the signs we've discussed today, and those signs resolve on their own, that resolution is not your safety clearance. That is your window of opportunity. Use it. Call emergency services. Go to the emergency room. Do not drive yourself. Do not call your doctor's office and wait for a callback. Present to an emergency facility immediately, because TIA treatment initiated within hours can reduce the risk of subsequent stroke by up to 80%. Let's come back to what we covered today. 9 early warning signs your body sends before a major stroke, signs that most seniors mistake for fatigue, aging, stress, or nothing at all. Sudden confusion and difficulty understanding. Weakness or numbness on one side. Sudden vision changes, including that fleeting curtain over one eye. A headache unlike any you've had before. Sudden trouble with balance or walking. Difficulty speaking or finding words. A sudden gap in memory you cannot explain. Facial drooping on one side. And the most deceptive of all, symptoms that simply went away. The FAST acronym, Face, Arms, Speech, Time, is your immediate action framework. And now you have 8 more warning signals to add to that recognition toolkit. You cannot make good decisions about your health with incomplete information. Most of these signs come and go in under 5 minutes. That means most people never get the chance to describe them to a physician, unless they're watching something exactly like this before the event occurs. Share this video with someone you care about. An adult child, a spouse, a neighbor, a friend who lives alone, because the person most at risk is often the least likely to recognize what's happening in themselves. Your awareness could be the intervention that changes everything for them. If any of these signs are familiar, if you've experienced something like this and dismissed it, please speak with your physician this week. Not eventually, this week. Your brain gave you a warning. Honor it.